Over-the-counter, OTC, omeprazole is used in adults to help control heartburn that occurs 2 or more days per week. Omeprazole may cause new or worsening symptoms of lupus. Omeprazole may be used to treat certain stomach conditions by decreasing levels of stomach acid. In this video we will discuss what is omeprazole, its warnings, and how it works and much more. Welcome to my channel Medicine Guide. So let's start, but before that please subscribe to my channel Medicine Guide. Now let's explore. What is omeprazole? Omeprazole is used to treat excess stomach acid in conditions such as non-cancerous stomach ulcers, gastroesophageal reflux disease, GERD, active duodenal ulcer, Zollinger-Ellison syndrome, and erosive esophagitis. Omeprazole works by blocking gastric acid production and is from the group of medicines called proton pump inhibitors. Omeprazole may also be given together with antibiotics to treat gastric ulcer caused by infection with Helicobacter pylori, H. pylori. Over-the-counter, OTC, omeprazole is used in adults to help control heartburn that occurs 2 or more days per week. The OTC brand must be taken as a course on a regular basis for 14 days in a row. Now have a look on warnings. Omeprazole can cause kidney problems. Tell your doctor if you are urinating less than usual, or if you have blood in your urine. Diarrhea may be a sign of a new infection. Call your doctor if you have diarrhea that is watery or has blood in it. Omeprazole is not used for the immediate relief of heartburn symptoms. Omeprazole may cause new or worsening symptoms of lupus. Tell your doctor if you have joint pain and a skin rash on your cheeks or arms that worsens in sunlight. You may be more likely to have a broken bone while taking this medicine long-term or more than once per day. After discussing all this, we should know now some omeprazole patient tips. Let's start first discussing how it works. Omeprazole may be used to treat certain stomach conditions by decreasing levels of stomach acid. Omeprazole reduces the production of stomach acid and works by irreversibly blocking the actions of an enzyme responsible for acid production, called hydrogen/potassium ADPase, also known as the gastric proton pump. The proton pump is located in the parietal cells of the stomach wall. Both baseline gastric acid secretion and stimulated gastric acid secretion are affected. The degree that they are affected depends upon the dose of omeprazole. This allows damaged tissue in the esophagus, stomach, and duodenum to heal and reduces the risk of new ulcers from forming. PPIs are also used to treat other gastrointestinal disorders characterized by excessive acid secretion. Omeprazole belongs to the class of medicines known as proton pump inhibitors, PPIs. Now have a look on its upsides. May be considered for the short-term treatment of gastroesophageal reflux disease, GERD, also known as heartburn, and erosive esophagitis, a severe inflammation of the lining of the esophagus, the tube that carries food from the mouth to the stomach. May be used in addition to antibiotics to eradicate Helicobacter pylori, a bacteria found in the gut that is linked to gastric ulcers. Can be used for the short-term treatment of active duodenal ulcers in adults. Most people heal within 4 weeks. Useful in the treatment of hypersecretory conditions such as Zollinger-Ellison syndrome. Usually, only up to 4 weeks of treatment is required. However, some people may require an additional 4 weeks. Omeprazole may also be used to maintain the healing of erosive esophagitis. Omeprazole is available as a tablet and capsule formulation in various strengths and also as an oral suspension. Generic omeprazole is available. Now let's discuss its downsides. If you are between the ages of 18 and 60, Take no other medication or have no other medical conditions. Side effects you are more likely to experience include diarrhea, a headache, drowsiness, abdominal pain, nausea or vomiting, or tongue discoloration. May also interfere with some laboratory tests. Taste disturbances have also been reported, but these usually resolve on discontinuation of therapy. Prolonged treatment, greater than 24 to 36 months, may cause vitamin B12 deficiency. The risk is greater in women, people younger than 30, and with higher dosages. PPIs, including omeprazole, have been associated with an increased risk of osteoporosis-related fractures of the hip, wrist, or spine. People on high-dose or long-term therapy are more at risk. Has also been associated with other conditions such as lupus erythematosus and magnesium deficiency. Administration of PPIs, such as omeprazole, has been associated with acute interstitial nephritis, a severe inflammation of the kidneys. May occur on medication initiation or at any point of therapy. Symptoms include fever, rash, and generalized aches and pains. Discontinue omeprazole and seek medical advice. Has been associated with a greater risk of Clostridium difficile associated. Diarrhea. See your doctor if you develop diarrhea that does not improve. May interact with some other medications including methotrexate and sometimes warfarin. Omeprazole can also reduce the absorption of drugs that are dependent on a certain gastric pH for their absorption. It may also interact with drugs metabolized through the cytochrome P450 pathway, particularly CYP2C19 and CYP3A4. Some studies have suggested PPIs, such as omeprazole, are associated with a higher risk of stomach cancer and kidney disease. There are no adequate or well-controlled studies of omeprazole during pregnancy, but animal studies have shown changes in bone morphology in offspring of rats dosed throughout pregnancy and lactation. Use only if potential benefits justify the risk. It is unknown how omeprazole affects a breastfeeding infant. Bottom line: omeprazole decreases stomach acid production, which promotes the healing of gastric and duodenal ulcers and other inflamed areas of gastrointestinal tissue. The risk of interactions with omeprazole is greater than with other PPIs such as lansoprazole and pantoprazole. Omeprazole is best used short-term. Now have a look on tips for use, usually taken once daily. However, take it as directed by your doctor. Use the lowest dose for the shortest amount of time appropriate to the condition. Being treated, administer on an empty stomach at least 1 hour before a meal. Do not crush or chew tablets or capsules. Swallow whole. Capsules can be opened and the contents mixed with applesauce and swallowed immediately in patients who have difficulty swallowing capsules. Do not heat, chew, or store the applesauce for later. A commercially prepared suspension is available. A pharmacist can also make one. See your doctor if you develop any unexplained fever, rash, particularly one that gets worse after you have been in the sun, new or worsening joint pain, persistent diarrhea, or generalized aches and pains. Also see your doctor if you develop any muscle cramps, spasms, or weakness, jitteriness, abnormal heartbeat, dizziness, seizures, or any other symptoms of concern. Tell your doctor if you are breastfeeding, pregnant, or intending to become pregnant because omeprazole may not be suitable for you. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer: channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.